Hi, so I finally finished reading my book, and I was going to do a critique over the whole thing. So the first question was, how does the individual deal with the mental illness? Lori really struggles with her schizophrenia, and at first she denies that she's even sick to begin with. She thinks that some of the people in the hospital are trying to trick her into making herself think that she's actually sick when she thinks that she's not. So at first she pretty much denies that she's sick at all. And then eventually, towards the end of the book, she finally realizes that maybe the voices in her head are, in fact, in her head and aren't real. And at that point, her healing process really starts to begin because she can accept her illness and try to live with it and learn from it and cope with all of those things. But Lori isn't the only one that was affected by the mental illness. Her family as well was affected by this mental illness. Her mother came to the conclusion that her own mother, Lori's grandmother, was not just an odd woman. She actually had some of the same signs as Lori and in fact had schizophrenia as well. And her mother realized that her schizophrenia ran in the family. And at one point she was worried that both of her sons would also have schizophrenia. And as Lori's illness tore apart the family, in other ways it also brought the family together. Her father had to realize that he was putting a lot of pressure on Lori and his other sons. And he had to realize that maybe he should lighten up on them. And it brought Lori's mother and father closer together, as well as her brothers. Her brothers had to really take a step back and think about everything they had with their sister and realize that just because she's sick doesn't mean that they are also going to be sick. And they also had to learn that it's okay to be sick. One of her brothers said that in that kind of community they would kind of push aside anything that was wrong and pretend like nothing else was wrong. And he had to come to terms with the fact that she was sick and it was okay to tell other people that she was sick. The next question is, what type of therapy did he or she receive, and how did he or she respond to the therapy? Lori went through a lot of drug therapy. She tried pretty much everything that was out there for schizophrenia, and not a lot of it seemed to work. She also went through therapy every day just with a psychiatrist and a psychologist to try to work through all of her internal problems and kind of go with medication with that. And at first, Lori didn't feel comfortable opening up to a psychologist or psychiatrist because she believed that the voices would hurt her if she said anything about them, and she didn't want herself to be hurt or others to be hurt. And she also felt awkward talking to them about her problems. She kind of felt that they didn't really need to know what was going on in her life, and she was afraid to say something wrong to them and have them put her back into the hospital. So that was a challenge for her. But as time went on and she met Dr. Dollar and Dr. Fisher, she became more comfortable with them and was able to really open up and let them into her world. And she finally was convinced to keep a journal, which was very helpful for both the doctors and herself, being able to go back and read everything that she wrote and come to terms with exactly what was going on. And because she felt that she couldn't say it and verbalize what she was feeling because she was afraid of the voices, writing was something that she could do to convey her feelings and actually tell Dr. Dollar and Dr. Fisher what exactly was going on in her head. The next question is about medication. Did they require medication? Did she respond to the medication, and what else aided her recovery? Like I said, she tried pretty much every medication that was out there. She tried electroshock therapy. She was kind of put in a last resort position where she was willing to try whatever there was to help fix her. The electroshock therapy, after about 20 tries, didn't really seem to improve anything, and her medication would work during certain periods. The first few weeks it would work, and then it would start to get acquired to her body, and her body would not react to it as well as it would. So she would start off with one thing and be really hopeful with it, and then it would kind of fade out and its effects wouldn't work anymore, and they'd have to start something new. The last thing that she tried, the clozapine, was the only thing that really worked for her and was able to allow her to have a normal life again, as close to normal as a person with schizophrenia is able to get. Of course, she wouldn't be able to have the same life as she did before, but it is much better than living in a quiet room with wet packing constantly. Her behavioral problems kind of went away with that, and she said that she felt that she was sharper and more clear, and she could think about things instead of the paragraphs where they're just words and periods and all of her thoughts were scrambled. She was able to focus on one thing at a time and more in depth because of that. Also, what aided a lot in her recovery is the fact that Dr. Dollar and Dr. Fisher were able to get her to understand that she was sick. Realizing that she had a mental illness was her first step in really recovering. Without the medication, it wouldn't have worked, but without this realization, it wouldn't have worked either. So they kind of contributed 50-50, but without her being able to internalize that she in fact was sick and that the voices weren't real, she wouldn't have been able to learn how to control them, learn how to make them quiet, learn how to not listen to them. She was able to realize that they were her emotions, and the only way that her emotions could get out was through the voices. So she started to listen to what the voices were saying and break them down into something that she realized was her own emotions. And then from there, she was able to take those emotions and use them in a positive way and get rid of them in a healthy way rather than being controlled by the voices. And the last question is, overall, how did the persons view his, her, their experiences, and how did they find peace of mind? Lori has come to realize that her experience was remarkable and that she was some of the very few people who actually are able to recover from this and not have to live in a hospital. She lives independently now and has a job and helps other people with their illnesses. And I think that she's come to realize that her journey isn't over, but the worst part of it is if she keeps it under control and has learned to manage it. It has also very much so impacted her family. I think that they've grown closer from the experience and learned a lot about themselves just by looking at Lori and her illness. And I think that the peace of mind that Lori feels is knowing that she has control over this and she has a say in her life. It's not that she's watching other people move on with theirs as she sits in a hospital. And I think being able to feel that control and that comfort is one way that she can actually successfully live, not necessarily without the voices because they will always be there, but live with them in a way that she can control them and live her own life without them having to take over. I think that Lori is one of the most remarkable cases because she was able to reflect on her whole past and write it in a complete book and be able to be in a position where she could actually see from a different perspective her own life and not from being trapped inside where the voices are. Now she's actually more of her old self, being able to see what had happened and realize why that happened, what was going on, what was wrong while that happened. So I think she hasn't made a complete recovery, but compared to all of the other cases that I've read about in the research, it's one of the most incredible ones.